All right, so tonight we'll be talking about exercise during pregnancy. It'll be about a 40-minute presentation. And just to give you guys a little bit of background on myself before we begin, my name is Mary Clemens. I'm a physical therapist and certified athletic trainer. I work for Team Rehab Physical Therapy, and I've been there for about 4 years now. And I work at the clinic in St. Charles, Illinois. I have worked in the orthopedic world for the past 5, 6 years and started to get interested in women's health and working with women who were pregnant about 2 years ago when I had my first son, and realized that there wasn't a ton of information out there about what you should do exercise wise during pregnancy as well as in the postpartum period. So I started taking some courses and got more involved, and now I am working in the women's health and also in the pelvic floor regions. So the objectives of today's presentation are to talk about the research on exercise during pregnancy, to discuss the guidelines from the American College of OBGYNs, to discuss the changes with exercise during pregnancy and the impact that that might have on your body, and then to give you ideas of exercises to perform while you are pregnant. So can I exercise during pregnancy? The big question. Not only can you exercise during pregnancy, you should. The healthier you are, the better it is for your growing baby. The easier recovery will be following your birth. And not only is it safe, but it's recommended to exercise until the very end of your pregnancy. So I always like to use the analogy of you wouldn't sign up for a marathon and not train for it. So it's the same kind of idea with pregnancy. Labor and delivery is probably going to be the most intense workout of your life. And you really want to make sure that you prepare your body for it. So you want to do training, you want to do working out and exercise so that your body is prepared for this big event. So the first portion of this presentation is going to go over what the research says involving exercise during pregnancy. All the citations will be available at the end of the presentation if anyone wants to look into any of the articles a little bit more. And this first slide here is just really going to summarize the big bullet points of what the studies say on exercise during pregnancy. So they found that it's associated with a higher cardiorespiratory fitness, the same as someone who's working out who's not pregnant, the prevention of urinary incontinence, which is really important in the postpartum period when your pelvic floor is recovering. It shows a decreased level of intensity of low back pain, reduced symptoms of depression that might occur due to hormonal changes in the body, a control of healthy weight gain during pregnancy. You want that weight gain, if you are at a normal BMI prior to pregnancy, to just be between 25 and 35 pounds. And it shows a decreased need for insulin in cases of development of gestational diabetes. They found that there's no association with women who exercise during pregnancy and miscarriages or preterm birth rate. And they also found that the type of exercise does not matter. So I think this is such an important point because you can do whatever you like to do. So you don't need to pick something that you don't enjoy. Pick a form of exercise that you already have been thinking about or that you do enjoy. And that's a really good place to start. So now we'll go a little bit more into the specifics of what the research says. So when it comes to health quality of life, they found that those who participated in exercise improved their health quality of life more than the control group. So they found that there was a decreased risk of depression, increased overall mood, and increased ability to sleep in those who worked out compared to those who did not. When it comes to low back pain, it didn't necessarily influence the prevalence of low back pain. And that's really due to the fact that low back pain is very prevalent during pregnancy. But it found out that those who exercised regularly were able to handle this low back pain better. And a really big point from that is that these women had less sick leave so that you can save your PTO for when the baby comes. Now, this doesn't surprise me much that women who exercised had lower intensity of back pain because exercise is the best thing you can do when you have low back pain. So even if you are experiencing some low back pain during pregnancy, the best thing to do is to do some movement. Go for a walk, get some exercise because it really will help the low back pain. When the research looked specifically at delivery method, they found that there was a decreased percentage of C-sections and instrument-assisted deliveries in the exercise group. Now, as a mom who exercised throughout her whole pregnancy and ended up having 2 C-sections, that doesn't mean that it eliminates the possibility, but any decrease in that is a good thing to look forward to. When it came to preterm birth rate, it found a reduced risk of preterm birth rate of almost 40% in women who perform some kind of exercise. So that's pretty significant that if you are exercising during pregnancy, there's a 40% decreased risk of a baby coming early. And we all know that we want our babies to stay in as close to that 40 weeks as possible so that they can be as healthy as they can when they come out. Now, I know something that often comes up is people are worried, is it healthy or safe for my fetus, for my body temperature to go up while I'm working out, while I'm exerting myself? And this study specifically looked at the danger in body temperature and found that none of the pregnant women who were working out when they were at 69% of their max heart rate had anything even close to a dangerous body temperature. And then this also looked at the oxygen saturation and found, so basically you want to be above 90% above to be in that safe region when you're working out. And they found that throughout pregnancy or throughout exercise, these pregnant women stayed at 95% or above. So the next portion, we're actually going to talk about the specific guidelines of the American College of OBGYNs when it comes to exercise and just pregnancy in general. So we'll go over the bullet points, and I think there's a lot of important information that can be gathered from this. So the big thing is they recommend and promote exercise for everyone. So this includes women who weren't doing anything prior and those with medical conditions. Now, obviously, if you have a medical condition or something that you're worried about, you should discuss it with your OBGYN first to get clearance, but they recommend exercise for everyone. So in the absence of contraindications, they encourage women to exercise at a regular, moderate intensity to continue to derive the same benefits that you would before you being pregnant. Another important point to talk about is the caloric increase. So I know a lot of people will say, oh, now you're eating for two, and we might sometimes feel that way, but really we should only increase our calories by 300 calories per day. And that's only in the second and third trimester. In the first, we really don't need to increase calories at all. So that's all that's required to continue to meet the metabolic needs of pregnancy. And that's really not too much for us just to kind of imagine. It's an apple with some peanut butter or a small bagel. So it's just something to think about. You want to make sure you're not consuming too many calories. Now, obviously, a point to think about is if you're adding exercise to your routine and you've never done it before, you're probably going to need to increase your calories a little bit more because you are adding something that you weren't doing previously. Another point that they bring up in their guidelines is that you have a decreased oxygen availability when you're pregnant. So there's several reasons for this. One being the increased resting oxygen requirements due to the growing baby, and also the increased work of breathing because of the pressure that your growing uterus is putting on your diaphragm. So this is something to be mindful of during aerobic exercise, as it's going to become more difficult when you're pregnant, and there's nothing wrong with that. So if you are experiencing shortness of breath during an activity that you didn't previously, don't feel discouraged. You just might have to change your habits a little bit and change things around to be able to deal with this decreased oxygen availability. Another note is that your basal metabolic rate also increases during pregnancy. So that means there's an increase in heat production. This is something that you need to be aware of when it comes to exercise environment. So as I talked about in that previous study, they found that women didn't have a dangerous increase in body temperature when they were working out, but that was in a controlled environment. So if you're thinking about being in a hot, humid environment and working out, it might not be as safe. So if it's a hot, humid day out there, it's probably a good idea to stay inside during those instances. Another point to talk about is the ratings of perceived exertion. So a lot of times we talk about using heart rate monitor to monitor your exercise intensity, but your heart rate changes at rest when you're pregnant. So it's not as accurate of a measurement. So they recommend using the RPE scale, which is over to the right here. It's a scale from 6 to 20. And at 6, it means no exertion. So you're not doing anything. And 20 is your max exertion. So a moderate exercise would be considered somewhere between 12 and 14. So if you were previously sedentary, they recommend that you stay between the mild to moderate range. And then if you were previously active, you can be higher than that. So you can be between that moderate to high range. Now, what type of exercise and how often should you perform it? Exercises should be performed at least 3 times a week for 20 to 30 minutes, and more is okay. So at least 3 times a week, you should be doing something. Now, I know that can be difficult at times, especially in the first trimester of pregnancy when we're not feeling good and we're nauseous. But it's really important to just try to do a little bit, because a lot of times exercise, getting outside, doing something light is actually going to help with some of those symptoms. The exercise should include both aerobic exercise, so your cardio, and your strength training. So when you're thinking aerobic, that's walking, running, swimming, elliptical, low impact aerobics, yoga. And then strength, it's talking about doing things with your body weight or resistance bands or free weights. Something that's important to think about when you're doing strength training is to make sure you inhale when you're preparing for the exercise and then exhale during your exertion. Now, if you'll note, I haven't talked about anything just yet about what you should avoid during pregnancy, because the reality is there's not much. So that's why this presentation is about what to do, and it's a lot of things as opposed to what not to do, which is so few. So really the only things you need to avoid are contact sports. You don't want to get tackled while you're pregnant, scuba diving and skydiving, and that's really due to pressure changes that you don't want your baby to be experiencing. Otherwise, you can do whatever you want. You can do what you were doing before and what you enjoyed. That could be running your whole pregnancy. It could be continuing CrossFit, lifting heavy. If you were doing it before and it feels okay while you're doing it during your pregnancy, it is more than acceptable to continue that. So the big question, how do I know if I'm doing too much? Really, it's as simple as listening to your body. If it doesn't feel right, then it isn't, and your body is going to tell you that. If you did it before, you can continue to do it during. So like I said before, that can include things like CrossFit, lifting heavy, jumping, doing plyometric exercises. Now, the one thing with that type of stuff, like jumping, is you might need to cut back on it a little bit just because of the growing belly and your ligament laxity. But if it feels okay, you can still try it. And then when it comes to weights, you might want to decrease the weights a little bit and do more reps. But once again, if you're feeling okay and as long as you're breathing correctly, you should be okay to continue to lift heavy. So the warning signs to terminate exercise when you're pregnant. If you're having any vaginal bleeding, dyspnea before exertion, so shortness of breath before you're even exerting yourself, you shouldn't exercise at that point. Dizziness, headache, chest pain, muscle weakness, calf pain or swelling, preterm labor, decreased fetal movement, or amniotic fluid leakage. So these are signs that you should stop exercising if you're experiencing them. So things to consider while exercising. So we really want to think about some of the changes that your body is going through. So one of those big things is that you have an increased weight. So if you're later on in your pregnancy, there's a good chance that you're 20 pounds, 30 pounds above your normal weight. And that's going to put increased forces across the joints. So they find that with that weight gain, when you're performing weight-bearing exercises, such as running, it can be an increase of 100% of the forces across your joints. So this might cause some discomfort to normal joints. So you might find yourself having some aches and pains that you didn't previously with exercise. And then if you do have a previous injury or any arthritis in a joint, you're probably going to feel it more, and it could cause an increased injury. So that's just something to be mindful of. If you are having a lot of pain, it's probably time to move to something lower impact, like running in the water or performing the elliptical. Another important point is that pregnant women typically develop a lumbar lordosis. So almost everyone is going to end up with an increased lumbar lordosis. So if we look over at this picture to the right, this shows what your spine normally looks like. And there normally is a small curve in your lower back, and that is supposed to be there. But when you're pregnant and you end up having all that extra weight in your front, it changes and it pulls that force forward, and you end up developing a larger curve in your lumbar spine, in your low back. And this is a big reason why people are at increased risk of low back pain. Now, a lot of the stuff out there says the increase is about 50%, or prevalence is about 50%. I would say it's probably much higher than that. It's just underreported. But once again, we talked about that exercise and movement is good for your low back pain. So this is no reason to stop exercising. Just be mindful that this might be, there's certain exercises that you might be not able to perform because of the increased lordosis and the pain that you're having in your back. Along that same point, when you have that extra weight through your front, it changes your center of gravity. So this might cause to a decrease in balance or stability. It's just, don't think about that as, oh, you're suddenly going to be falling over, but more so if you're doing single leg exercises, you might not find yourself being able to hold those poses or perform those exercises as well. And then a really big point is that you have increased ligament laxity, and that's because of the increased levels of estrogen and relaxin in the body. So you need to be careful with that, with end range motions, with stretching, some yoga poses. Sometimes women will find it useful to wear things like a belly band or an SI belt, or do some KT tape to help with some of the pains that you might get from that ligament laxity. So to summarize the benefits of exercise during pregnancy is they are plentiful. There are lots and lots of benefits, and that's really why you should exercise. We've gone through all of these and you can read through them. I think the one that we just didn't touch on is that last point, that there's a decreased risk of obesity and diabetes in the newborn later in life. So I didn't go through that research article previous in the presentation, but there's research out there that finds that later in life, so years later, your child is at a decreased risk of obesity and diabetes if you did exercise during your pregnancy. So that's another great point to summarize why it's so beneficial. So now is the portion where we're going to start talking about exercises for you to perform while you're pregnant. Now, this is in no means an inclusive list. There's lots and lots of other things that can be performed, but it just gives you a good idea, some muscle groups to work, some different positions to perform them in. So the first thing we're going to talk about is working your inner core. And I like to call this the powerhouse of the body. So this diagram to the right here is a very simplistic version of showing what this entails. So you think about it as a house. So the pelvic floor is the floor of the house. The diaphragm is the roof. The multifidus, which is your deep back muscle, and your transverse abdominis, your deep core muscle, are the walls. So if any of these components aren't working properly, the house falls over, right? So you want to make sure that your entire inner core is activating, because otherwise you can end up with more low back pain or other issues. And the great thing about a lot of these muscle groups is that you can work them while you're sitting, while you're at your desk, and people won't even know that you're doing anything. So the pelvic floor, most people know what a Kegel is, and that's how you work your pelvic floor. So two ways that I like to cue people for that is pretend like you're going to the bathroom and that you have to stop the flow of urine, or pretend like you have a straw and you're trying to suck something up with your vagina. And those are two ways to get you cued to activate that area. There's two different exercises that you should be performing with that. So you should be performing that, squeezing that, stopping the flow of urine and holding it for 5 to 10 seconds. And then also doing a quick twitch. So you're pulling up and then you're relaxing, pulling up and relaxing. And that way you're working both types of muscle fibers that are in the pelvic floor. Now, one thing to note is Kegels are not the right exercise for everyone. There are times where people have too much tension in their pelvic floor. And so if you're having any sort of pain with these, don't continue them, because like I said, it's not an exercise that everyone in the world should be doing. There are times where it's not appropriate. When it comes to your transverse abdominis, so that's your deep core muscle, and the way to activate that is by pulling your belly button to your spine. So you feel yourself get taller and elongate. And it's worked the same way. It's worked the same way that you would work the Kegels, as far as doing holds that are a little bit longer, 5 to 10 seconds, and then also doing some quick fires of those muscles. Now your diaphragm is your breathing muscle. So it's worked through belly breathing. So most of us, especially Americans, are chest breathers. We breathe and we fill up our chest. To work the diaphragm fully, you want to breathe and fill up your belly and then let it exhale from there. So it's always great to watch videos, because this sounds like something easy, but when you've been breathing with your chest your whole life, it's really very hard to teach and hard to do. And yoga is another great way to get used to the proper breathing. And then the multifidus is the only one you can't work while you're just sitting there, but it's activated through planks and other exercises, and we'll go over the planks a little bit later in this presentation. So the next part of this presentation, we're going to go over exercises in several different positions. So I have videos, and bear with me on the quality because they were recorded in my house by myself, but they are videos of me doing exercises during my first pregnancy. And I'm just going to kind of let them run as I talk through them. So this first set of exercises is bridges. So going up and down a bridge is great for your core, your glutes, your back. And there's several different ways you can kind of. That was just a bridge for going up and down. You can sustain it, so you hold it up there for a longer period of time. And you can make that period of time whatever is comfortable for you. And then there's also what we call a bridge with hip abduction. So you're activating your glute med at the same time. And it's just another way to vary bridges. But I like having bridges be part of your daily routine. And then this is that final one, the bridge to hands. So going up on your hands. And that's a little bit more advanced. So don't do that one if it doesn't feel comfortable for you. The next couple are ones that are going to work your core. So this is heel touches. So like you're bringing your fingers towards your heels. And that gets the core muscles. And this shows a transverse abdominis, so that TA contraction. So you can even see with a big belly that core gets engaged, like you're pulling that belly button to the spine. And you perform that while you're doing some other core exercises. So you tighten your core and do marches. And then finally here, it's going to show in a second some side crunches. So these are just some ideas of some exercises you can do while you're in the supine position on the floor. I know one thing that people might read and you hear a lot on the internet is that you shouldn't lay on your back during pregnancy. And the reason behind that is because it can put pressure on your inferior vena cava. Just like with everything else, your body's going to tell you if it's not right. So if you're on your back and you're starting to feel dizzy, lightheaded, clammy, then yes, please get out of that position. If you're feeling okay though, it's fine to be on your back for short periods of time. I always like to say when you are getting your ultrasound at the doctor's office or during labor and delivery, you're on your back for a pretty extended period of time. So if it's okay during those things, it's probably okay to be doing it for a short period of time while you're exercising. So this next set of videos is going to show some exercises on the stability ball. So I'm going to start them and then kind of talk through them. So these are showing this first couple bullet points here. So this is a pelvic tilt. So it's like you're tucking your butt in and sticking your butt out while you're on a stability ball. And this is just another view of it. And this first couple that I'm just going to show in the video, these are really good if you're having any low back pain during pregnancy. So next it's going to go into a lateral tilt. So you're going to be going side to side, and same kind of idea. It's like you're shifting your weight and you're getting that the SI joint to work a little bit more. And then some pelvic circles. So, this is still that lateral tilt, just a different view of it. So that's side to side, and then pelvic circles are going to come next, and it's like you're doing the hula hoop on the ball there. And then this next set of videos is going to show seated march. These are to activate your core muscle and seated kickouts. Other things that you can be doing on the stability ball, if you're not comfortable doing them on the ground, are crunches and side crunches, which you can do by just scooting your butt so that you're not on the ball you're not sitting on the ball as much, as more on your lower back. And then when you're standing, you can be holding the ball in front of you and doing some rotations, some diagonals, which are wood chops. And then you also can use the ball to be able to do child's pose. Another thing to note with a stability ball is that you can just sit on a stability ball. So if you're at work or if you're watching TV and you're having back pain, just sit on the stability ball and it will feel better. It also, it's a method that they have you do when you're in labor as well to help with pain. So a stability ball is a great investment. They're normally $20. As far as a size, normally between 55 centimeters and 65 centimeters is good if you're on the tall side. So if you're probably, if you're above 5'7", you probably want to go with a 65 centimeter. Otherwise, a 55 would be fine. And the reason for the size is just you want to be in the proper position when you're sitting on it. Oops. Let's go to the next slide here. So standing exercises. So with these exercises, you can be doing it with a kettlebell like I'm doing here. So this is a side bend. This is another core exercise. You can be doing it with a free weight, with a resistance band, or no weight. So whatever feels comfortable for you. This is showing a trunk rotation, just another way to get that core engaged. And then the next couple are going to be showing different forms of squats. So squats are great to perform during your pregnancy. They really help you prepare for your labor and delivery. So really some form of squat should be performed every day. So you can just be doing a standard squat. You can be doing a little bit more advanced with the kettlebell here. So this is the squat with the upright row. And then the sumo squat just changes the position of your feet. So you just bring your toes out towards the side, and that allows you to engage your adductor muscles. And then it's also going to show here in a second a lateral lunge, which is just out to the side. That's another way to engage your adductor muscles. And then the final exercise is a 3-way hips. It's going to be where you kick back, side, and forward. And these are all just ideas of exercises that you can perform in a standing position. There are plenty of other ones that will be helpful. And like I said, you don't have to use weight with these. These can just be body weight. So you just got to do what is comfortable for you. So now we're going to go through arm exercises. So this first video is showing me sitting on the stability ball doing them. You don't have to be on the ball, but for me, it's just a 2-for-1, getting 2 things going at the same time. So this is with the TheraBand, this external rotation, so working your shoulder muscles. And then this is that horizontal abduction, so you're coming out and straightening your elbows and going across the chest. TheraBands are very cheap to get online. You also, if you know a physical therapist or if you've been to one before, just stop in and ask them to cut you one, and they most likely will give that to you for free because we have them around. And this is that shoulder diagonals. So these are all important muscle groups in the shoulders to be working during pregnancy. And then just to show another couple here, so these can be done with the resistance band. These also work pretty well with the free weight. So that's a lateral raise, going out to the side to get your deltoid muscles. And then they're going to show a forward raise going straight out in front. Try to keep your thumb up with that one. It's just better for your shoulder joints. And then finally, you can be doing a bicep curl. So the reason that working your arms during pregnancy is super important is, one, it helps with your posture. So it helps you engage your postural muscles as your posture changes with your growing body. And also, you are going to be holding your baby a lot when they are born. So it's important to be strong so that you are able and capable to hold the baby, especially during things like breastfeeding. So I mentioned planks when we were talking about the multifidus earlier. Planks are so great. They work your core muscles, your glutes, your back muscles, your shoulders. They're just such a great exercise that encompasses so much. So it's always something that's really great to perform any point, pregnancy, postpartum. You want to wait till do them a little bit postpartum, but they're great for every group of people recovering from every injury. So it might be difficult at some point to perform a standard plank, so you can modify it by being on your knees. You can modify it by standing and leaning forward and putting your elbows on your bed instead, or the wall. But you should continue to perform them throughout your pregnancy if you feel comfortable, because it's really going to help keep your core muscles strong. And then this picture to the right here, we're just going to touch on diastasis recti because it could be a presentation all by itself. But I just want to go over it quickly while we're talking about planks. So this picture right here shows what your core muscles normally look like. So this is your rectus abdominis, your six-pack muscle, and it's connected by your linea alba. So that's tissue that connects them. Now, when you are pregnant, you need that all to stretch out to allow for your baby to grow. So that connective tissue gets stretched out. Your core muscles separate. Now, what happens is in the recovery process, normally they continue to be stretched out to some degree, but recover between 6 and 12 weeks. When it becomes diastasis recti, that is a problem is when that happens and doesn't recover. So when it continues to be stretched out because you don't have the same ability to activate your core muscles then. So normally this will recover within 12 weeks, but if it doesn't, it might be time to talk to your doctor to go see a physical therapist. And then I believe this is going to be my last video of exercises here. Yes, these are going to be the hip exercises. So I'll play this video while I talk through it. So these are clams here. These are all great because you're in this nice sideline position. This is a reverse clam. And then we're going to go into some leg lifts. So this is hip abduction. And I like to do all of these on one side at a time. This is hip adduction, so that you're not flipping back and forth, and then 2, it's also really fatiguing that glute med muscle. And then internal and external rotation as you're bringing your toes in and out. Hip circles will actually go around into circles, and then finally they'll just do a sustained hip lift. So normally what I say with these exercises is to do them, start with doing 10 reps at a time, then move up to 15 and work your way up to 30 reps. They're really good for low back pain, keep your hips strong, for posture, especially as you're changing. And just know these are going to be hard. I call this to even my athletes, we call this the hip burner set because it is going to cause your hip to burn by the time you're done with it. So when it comes to aerobic exercise, really you can pick whatever you enjoy here. So walking, running, elliptical, swimming, biking, something to get your heart rate up. And this should be done 20 to 30 minutes, 3 days a week, at least. So just another talking point is, when do I need physical therapy? So there are going to be people who go through their entire pregnancy and postpartum process and really don't have any issues, and they don't necessarily need to go see a physical therapist, but there are some issues that physical therapy really can help with. Incontinence being one of those, and it's probably a soapbox that any women's health physical therapist will jump on, is that it is not normal to pee when you're exerting yourself. It's not normal to leak when you're laughing or trying to exercise. That might happen during pregnancy towards the end because of the pressure on the pelvic floor, and then maybe to some degree a couple weeks into your recovery process, but it's not the rest of your life. So you'll hear some people say, oh, well, that's just normal because I had a baby. It's not. Physical therapy can help with it. We can strengthen those muscles, and you can live life where you never have to worry about laughing and wetting your pants. So please know that physical therapy can help with that. Diastasis recti, which we touched on just a couple slides ago. And then some things that you might experience before or after pregnancy that physical therapy can help with is low back pain, SI joint pain. It's a little bit lower. Some people will kind of describe it as their tailbone area. Pubic symphysis pain is pain in the front of the pelvis. And then if you're experiencing any sort of sciatica or any numbness or tingling down the leg, those are all things that physical therapy can help with. If you don't know how to go to a physical therapist, there's several different ways. One, you ask your OBGYN, they write you a script, you go to a physical therapist. And then the other is, in most states, Illinois being one of them, you have direct access. So you can go to a physical therapist and you don't need to have seen the doctor previously, and they examine you and see if you're appropriate, if you need to see a doctor before they start treating you, or if they could just start that first day. Another important point that I like to talk about with physical therapy is, I know sometimes finances can be a barrier. So people might be like, oh, well, I don't have the money to pay for going to physical therapy. But one of the things I like to tell people is that when you are pregnant, you're going through labor and delivery, you're going to spend several days in the hospital. You are going to meet your deductible and out-of-pocket max with all of those fees. So if you had your baby in February, everything's going to be free for the rest of the year. If you have your baby in March, you have time to work and kind of make sure you get physical therapy and not have to worry about any financial obligation with it. So it's just something to think about if you're kind of reluctant to start physical therapy. So in summary, pick exercises that you enjoy. Listen to your body. If it doesn't feel right, it isn't. Another point I like to make is, don't listen to the chatter. So you might have people telling you, oh, you shouldn't be lifting that. Oh, you shouldn't be running. Don't listen. If it feels fine, it is fine. Being active is helpful to both you and your baby. And if you need any help, ask. So let me be your resource. So email me if you have any questions with anything. So this is all my information. So this is where my clinic is located, and the phone number. And then that's my email. Oh, and then another thing that I forgot to mention when I was talking about the physical therapy is, make sure you ask if they have a women's health specialist or pelvic floor specialist if you are dealing with some of those specific issues, because they really are going to know how to treat you in the best way possible. So if you have any questions, you can enter those in the chat box now.